Hi, I'm Karen. I'm a doctoral researcher with the DiaDeM project. I came to my PhD through some work that I was doing for the DiaDeM project. At the beginning, I was working in a clinical service here in the UK, what's called psychological wellbeing practitioner. So I was working with people who had depression. And as part of the work that I was doing, sometimes I used behavioural activation in my clinical work. I was approached and asked if I would be interested in doing some work with the DiaDeM team to help them to adapt behavioural activation so that it would fit the context of populations of people with depression and diabetes multimorbidity in Bangladesh and Pakistan. There's quite a lot to think about, but in other ways, not so much to think about because the intervention itself hasn't changed much. We just have to think about making it relatable to people in a different country with different life experiences, different situations. And once I'd been working with the team for a little while, I heard that there were some PhD opportunities built into the project. Some years ago, I'd been quite interested in pursuing a career in research and maybe doing a PhD. But at the time, it was in a completely different field. For a number of reasons, nothing came of it. I didn't pursue it. So when this opportunity came up, it made me really revisit those aspirations. And I thought, this is something that I'd really like to pursue. And now feels like the right time. One of the things that I was really, I don't know, it felt really pertinent to me as a clinician was the clinicians that we would be working with in DiaDeM. So we're adapting an intervention for mental health. We're asking people working in diabetes services, to maybe take this intervention forward and deliver it in the context of patients with diabetes and depression. I thought, well, what's that experience like for them? We're really, really focusing on the intervention, and we're trying to think about, is it clinically and economically effective? Can you embed this intervention into services in a different country? But what about the clinicians? What's the experience like for them? So I'm a clinician. I've been through times when we've made changes in services, and that has an impact on you. So I started to become really involved with that. So that's what I'm focusing on in my PhD is thinking about what happens when clinicians go through this process of change. And I've been doing some work around what's called task shifting or task sharing, which is where you train individuals from a health service to deliver a specific intervention that's not part of their usual remit. And so I've been looking at how task shifting has been used in different health contexts. So I've looked at lots of studies in different countries, in other lower middle income countries, all kinds of studies really. So in different health contexts, so not just mental health, but also things like child and maternal health care, communicable diseases, HIV, all sorts of things, just to get a sense of what kind of experiences clinicians have gone through in those settings. And I'm using that information to inform a study that I'm just about to embark on, which is talking to our behavioural activation facilitators about their experience. So I'm not focusing on the intervention. I don't want to know what their thoughts are on behavioural activation, but I want to know what it's like to go through that experience of going from somebody who focuses very much on somebody's physical health needs and situations, so in this case diabetes, to when suddenly you're starting to ask people about their psychological well-being and trying to help them to make changes that can improve their mental health when they're struggling with depression. I can really relate to the clinicians who are working with us in DiaDeM in that I used to work in a physical health setting. So for many years, I worked as an occupational therapist in a rheumatology service. So rheumatology is about people living with long-term musculoskeletal conditions like rheumatoid arthritis. I went through that process of switching career, changing from focusing on people's physical health to mental health needs. So I went through that process of sort of redefining how I saw myself, and I'm quite aware of some of the anxieties I held at the beginning about what's it going to be about talking to people about their mental health. What happens if people tell me things that are quite distressing? I've maintained my sort of other focus as a behavioural activationist as well. So as alongside being a PhD student, I'm also part of the team that's still working on adapting the interventions and providing the training to be able to deliver that intervention. You can also find out more about what we're doing in DiaDeM by visiting our website. So that's the Impact South Asia website. And of course, you can always follow us on social media as well.